here to shed some light on these afflictions, serious mental health issues. The president and CEO of Global Institute for Forensic Research, Dr. J.P. Singh. Also joining our discussion, the founder of Loft 107, Joe Schrank. Joe's a longtime promoter of recovery involving those who have used drugs and alcohol. He runs the Loft, which is a sober living facility. Gentlemen, to you both, we thank you for coming in. And Dr. Singh, the first question goes to you. It is clinical and medically related. A lot of people are wondering now about depression. What are some of the signs of severe depression?
Certainly. Thank you so much for having me on. Some of the signs of depression that one can keep an eye out for is a prolonged feeling of being down. This being down, these blues that one is experiencing, though, are different than just having a bad day or going through a rough patch in one's life. They really have to significantly impact your ability to successfully function at work, function in an educational setting like at school, or your ability to socialize successfully. And in addition, you usually have problems with eating, with sleeping, getting enough sleep. These are some of the symptoms you can keep an eye out for when we're talking about major depression.
Dr. Singh, as we were seeing that you were mentioning these things, we saw the symptoms on the screen. Perhaps we can put them back up, but as our viewers were seeing a variety of symptoms, including feelings of worthlessness, helplessness, guilt. You mentioned the insomnia and a sudden loss of interest in activities, just that what we used to call, for lack of a better term, the blues, but it goes beyond that. And before we get to Joe and some of the recovery, just in terms of clinical treatment, there is some debate. I have heard some psychiatrists, psychologists, mental health professionals saying, yes, you can be cured of depression. Dr. Singh, in your opinion, is a cure realistic? Is that available to people?
You know, I think that this is a real catch-all term when we use the term cure. At the end of the day, as I said, everyone has their ups and downs in life, and really the goal of treatment when it comes to something such as depression or in bipolar disorder, such as Mr. Williams had, or reportedly had, really what we're trying to do is to be able to get the individual back to that level of functioning where they can experience life's normal highs and lows as they would without these often debilitating symptoms. So being cured of depression does not necessarily mean that one will never be down. It just means that the individual will be able to really experience all that life has to offer, both good and bad.
Joe, in your job, you are all about recovery. I want to talk to you some about what was going on in the case of Robin Williams. Certainly he did not hide his struggles publicly about his addiction to cocaine and problems with alcohol. There has been a suggestion of a cause and effect that long-time drug abuse can lead to depression and lead to mental illness. Do you buy that? And what do you try to do at the Loft to deal with those in recovery?
It's the chicken egg argument. Is the depression fueling the need or the desire to abuse drugs, or the drugs fueling the depression? Certainly intoxication helps nothing. It doesn't help any mental health issue. Cocaine, prolonged exposure to cocaine will create a cognitive distortion. So when people their expectation is the high that they experience while they're using cocaine, normal life feels depressed. So at the Loft, we try to support them with clean living. That would include nutrition. Exercise is a really important component for anyone experiencing depression. All the research suggests that it's as effective as medication. And when medication and exercise come together, the outcome can be really good. We also have a medical doctor here on staff. We believe that alcoholism, addiction, whatever, and depression are medical illnesses. They are centered in the primitive brain, and that should be treated by a medical doctor.
So it all comes together, and we understand that, Joe. I want to get both you gentlemen to comment. Joe, we'll begin with you.
Yeah.
We were talking a little bit earlier about the graphic detail that the county coroner through the sheriff's office offered yesterday concerning the death of Robin Williams. Joe, in your mind, was that just too graphic to be put into a press conference forum the way it was?
I mean, I think it was excessive. yes, we know that he committed suicide, and maybe that was enough to have the details, the grisly details of it. I'm not sure that added anything to the press conference other than just sort of salacious information that people can grab onto. Although, it's a horrible situation, and the man killed himself ultimately, by hanging with a belt. That seems to suggest that he was very ill. It was that's a pretty aggressive and angry act.
And it is also, some say, an impulsive act. But before we get to the whys and wherefores of that, Dr. Singh, the whole coverage of it, is there a concern that for some who are depressed, given the level of detail, it becomes a kind of how-to manual? What the coroner listed yesterday so graphically could be actually an enticement or instruction for those considering ending their own lives?
There's definitely a great deal of concern about this. I've had a number of people over the past 48 hours calling and asking, I have a loved one, I have a best friend, I have a spouse who's been diagnosed with depression or bipolar disorder. After an incident like this, do I need to be kind of on the lookout for my loved one, to make sure that they're all right? This is a completely understandable response. Something that's important to know is that when it comes to depression and suicide, or when it comes to bipolar disorder and suicide, even though there is a statistically significant relationship between these, the rates of suicide in these groups is still overall quite low. And so because of that, we want to make sure that we don't recommend to people that they, constantly be asking their loved one, are you having any thoughts? What's going on? We don't want to further stigmatize anyone who maybe already feels like they're being singled out, or that they're already feeling like, this is something that places me out of the norm. And a lot of people tend to have that kind of reaction when they receive a diagnosis.
Well, in terms of real life conversation, I'm wondering, for those who have friends or family members who are dealing with this, should they even raise the topic of Robin Williams' death? Doctor, first to you, then we'll let Joe finish up in the minute and a half that remains. Go ahead, please, Doc.
Absolutely. Just quickly, I think that it's important that we let our loved ones know if they do seem to be suffering from these signs and symptoms of a debilitating mental illness, such as depression or bipolar disorder, that one of the best things about going to see a mental health professional or a medical doctor is that we do have a number of different treatments that are available, both pharmaceutical, so drug-related, as well as in terms of talk therapy. So something they may want to look into, it's called cognitive behavioral therapy, or CBT, has been found to be quite effective with depression.
Joe, the last word goes to you as you deal with those trying to recover or in the process of recovery from substance abuse. About a minute left. I'd like to get a takeaway from you before we end this conversation, Joe.
I think that we need to start looking at mental health as a chronic illness. And it's a chronic illness that generally, in a cultural perspective in America, we deal with when it's in acuity. So it spikes our interest when there's a crisis, and it really is a chronic problem that should be handled by professionals.
And
people
gentlemen,
who have other chronic issues.
And gentlemen, to you both, we thank you for your insights on this. It is a topic we will continue to discuss in the days to come. It's something that is not going to go away, nor should it, from discussions here on America's Forum. Thank you both so much for your time. Moving from public health and mental health to public policy and politics. It was primary day yesterday for 3 states in our union. Coming up, an analysis of the results from both the right and the left. There could even be some disagreements on the numbers and what they mean. That's next on America's Forum.